Hello everyone, I am Jasmeet. Today I am here to discuss my book review Tell Me the Truth, written by Dr. Ranjana Shrivastava. The author was educated in India, USA, UK and graduated from Monash University with first class honor degree. She also won prestigious award in 2004 from Chicago University. She also working as oncologist and educator in public health hospitals in Melbourne and at Latrobe Valley. She oversees the chemotherapy treatment in adults and children suffering from cancer. Her writing has been published in different publications such as in Time, The Week, the New England Journal of Medicine and Lancet. The book I have chosen for the review is comprises of collection of stories about the patient and the episodes in author's own life which increase her understanding about the doctor-patient relationship and encourage her to learn in her life. It tells the story from the perspective of doctors and reflects day-to-day moments with her critically ill patient and their families. In this book, she also include different ways in which the patient and their families deal with one of their member who is having cancer and how they deal with the issues in their life and death. The author also discussed the way she deals with these changes. The author also discussed about her inspiration to become an oncologist from her nanima who was at the end stage of cancer. The main purpose of writing this book is to share her life experience by uncovering the human side of medical profession. She also shows that the best doctors are the one who keep learning by listening their patients' need and requirement. This book is acknowledged by incredible courage of ordinary people who face the big issues of life and death. She emphasized on the importance of humanity in the medical profession by highlighting the lacks of healthcare provider in public health field. While reading this book, I identify the key points or issues discussed by author that the doctor hesitate to tell the truth to their patient. They often hide the information from the patient about their disease condition because they do not want to put burden on them with the horrible details of their disease and consequent death due to their illness. The doctor goes around the patient with more hopes of surgical and chemotherapeutical intervention which extend their life, which is nothing more than abusing the rights of the patient. Author says that doctors do not open up with their patient to understand them, more especially with the cancer patient. Cancer patients put up with most and complain the least because they see the big picture, which is not as simple as it looks like. She also said that if you spend enough time with them, they will let you know what they feel actually. Furthermore, the author mentioned about the moral dilemma, anxiety, and challenges as she has experienced while treating a cancer patient. She has included an example of old lady who was suffering from severe pain due to the cancer of pancreas, and there was no medicine in the center to relieve her pain. The doctor demanded medicine from outside, but nobody was willing to give the medicine. At the end, when the patient was about to death due to the intolerable pain, a person came with the medicine. Then she was able to treat the lady. She observed that difficulties arise during the moment of silence rather than tense discussion in the oncological consultation when the given news was very bad like cancer. She also mentioned that No adequate training for the doctors to teach them how to talk with the patient who have a disease which is likely to kill them. Many doctors avoid to deal with the issue of death because they are trained to fight with the disease, not with the death. The author struggle with some issues that when to stop further medicine interventions other than the palliative care in the cancer patient. When should someone be taught that there is nothing more in a medical profession which they can offer to treat their disease? Should the doctor agree to give further chemotherapy which wouldn't extend the lifespan of the patient and slightly diminish their rest of enjoyment? Moreover, as cancer patients see their death very near, that affect them psychologically as well as physically. But the doctor does not consider the psychological needs of the patient. They just treat the patient at physical level, but never try to relieve their stress of disease on the patient's mind due to the terrible death and news. Moving to the critical viewpoint, various author has different viewpoint about the cancer patient. Leo Tolstoy, a philosopher, gives us a powerful message about the harm of lying to the patient from his book Lying to Dying Patient. This book tells us about lying is right thing to do in such circumstances, but he is definitely against the lying to the patient. A physician's vast Segal in USA said that people deserve the truth and it is his job to preserve the truth in patient and doctor relationship. There has been a time when he has regret that choice and he feel that the truth plays very bad role in patient's life. Joseph Colley argued that the doctor must frequently withhold the truth from the patient in some situation, which is eventually similar to lying. Situations considered by him are only those in which the doctor believes that it is patient's own interest to know and not to know the truth. But doctor has to communicate with the patient with enough time and efforts to tell him truth. He also mentioned several cases in which it seems to him that lying was the correct thing to do, whereas a philosopher named as Kant suggests that people are born with instinct worth known as human dignity, which must be respected by telling them truth, not by telling them lie. The American medical ethic based on informed consent doctrine gives the impression that patients have control over obtaining information, but close analysis of these accounts shows that physicians still hold the power to control information through their management of the information giving process. These issues discussed in this book can be easily treated by following recommendation. Respect the will and beliefs of the patient by communicating with them about their fear and stress. As the doctor cannot reverse the late diagnosis, it is better to communicate with the patient because it reduces the suffering of patient, provide ideal treatment to the patient, listen to the patient as it is. It will reduce the psychological burden of the patient. Inform and support them for decision making because they need someone to empower them to make their decision. Do not hide the diagnosis from the patient as it is violating the rights of the patient. Doctors should be trained to communicate and consult cancer patients. Doctor needs to think according to the patient's viewpoint to understand them in a better way. At the end of my book review, I would like to discuss and ask a situational question. Suppose you are appointed for a patient who is at the advanced stage of cancer. You know that chemotherapy may or may not work in this stage. In this case, will you tell the truth to the patient about his disease? If yes, then please give the reason why. These are some references that you can use to gather further information. Thank you for your patience and listening to me.